D-dimer. Overview. D-dimer assay will be discussed under the following headings: Introduction, D-dimer levels, etiology of pulmonary embolism, risk factors for pulmonary embolism, approach to pulmonary embolism, D-dimer in COVID-19. Introduction. D-dimer is a specific degradation product released into the circulation when cross-linked fibrin undergoes fibrinolysis by plasmin. Essentially, D-dimer is elevated whenever the coagulation system has been activated, followed by fibrinolysis. The D-dimer level returns to normal if clot is stabilized, as seen after treatment with heparin, and not undergoing any further fibrin deposition or plasmin activation. D-dimer has been widely studied in patients with acute deep vein thrombosis and pulmonary embolism. D-dimer levels. The normal range of D-dimer is less than 400 nanogram per ml. Important causes of elevated D-dimer levels include deep vein thrombosis, pulmonary embolism, disseminated intravascular coagulation, arterial thromboembolism, pregnancy and postpartum period, malignancy, thrombolytic therapy, and surgery. Etiology of pulmonary embolism. The risk factors for pulmonary embolism are the risk factors for thrombus formation within the venous circulation. That is, venous stasis, injury to the vessel wall, and hypercoagulability. Venous stasis increases with immobility, as seen with obesity, stroke, bed rest, especially post-operative, hyperviscosity, as in polycythemia, and increased central venous pressure, seen with low cardiac output states and pregnancy. Vessels may be damaged by orthopedic surgery, prior episodes of thrombosis, or trauma. Hypercoagulability can be caused by medications like oral contraceptives, hormonal replacement therapy, or diseases like malignancy, surgery, or may be the result of inherited gene defects. Risk factors for pulmonary embolism. Leg swelling and pain with palpation of deep veins. Tachycardia, that is heart rate greater than 100 beats per minute. Immobilization for more than 3 days or surgery in previous 4 weeks. Previous history of pulmonary embolism or deep vein thrombosis. Hemoptysis. Cancer with treatment within past 6 months. Approach to pulmonary embolism. When pulmonary embolism or deep vein thrombosis is suspected, the risk factors are assessed and D-dimer levels are measured. If D-dimer is less than 400 nanogram per ml and clinical risk is low, then deep vein thrombosis or pulmonary embolism are ruled out and no further testing is required. If D-dimer is elevated and clinical risk is high, then treatment should be started and diagnosis confirmed. If D-dimer is elevated and clinical risk is low, then diagnosis is confirmed using venous Doppler studies of lower limbs, CT pulmonary angiography, or ventilation perfusion scan. If D-dimer is less than 400 nanogram per ml but the clinical risk is high, then patient should be evaluated with venous Doppler studies of lower limbs, CT pulmonary angiography, or ventilation perfusion scan. Therefore, the D-dimer testing has high negative predictive value in excluding the presence of deep vein thrombosis and pulmonary embolism. D-dimer in COVID-19. You are requested to follow your country-specific guidelines. Measurement of D-dimer is not indicated in patients with mild COVID-19 disease. High level of D-dimer at the time of admission are associated with increased disease severity and mortality. Rising D-dimer after admission precedes multi-organ failure and overt disseminated intravascular coagulation. Current guidelines on use of anticoagulation are not dependent on D-dimer levels. Thank you.